The United States healthcare system is beyond flawed and wastes both its people's health and its economic superiority. Under the current system, 21% of insurance claims to private insurers are denied, and even when they aren't, the delays cost lives. If you have private insurance, you are nearly 10 times more likely to die with a head injury score of 3 to an uninsured person. This is explained by the delays caused by following the insurance claim protocols, which cause delay in care. However, as the injuries get more severe, those without insurance are actually the ones left to pay the difference in lives. As with a head injury score of 5, those with insurance survive nearly 20% more often than those without. On each end of the spectrum, lives are valued more than money, as those who can be saved easiest are bureaucratized into severe danger, while those in severe danger aren't treated to the best of our abilities due to lack of funding. This isn't a problem only in emergency rooms either. This isn't explained away by speed of response or rush and confusion of the scene. The same can be said about patients of cancer. Those with cancer without insurance have a 5-year survival chance of 77%, while those with private insurance have a 91% chance of survival. This is consistent with a higher level of care for those who are privately insured. So, that settles it. Insurance is the way to go. Except that is if you rely on Medicaid. Your chances drop down to 70%. This shows that those who are relying on government health care are actually often worse off than those who are able to afford to go into debt in the short term. This leads to an almost linear correlation between income and survival rates. The United States spends almost $13,000 a year per capita on medical expenses, covering around 46% of all medical expenses through government spending, and spending 14% of the federal budget on Medicare, while Canada spends about half as much, $6,500 per capita, while also covering 70% of all medical expenses through government spending. And with only about 16% of it going to administrative fees, this leaves Canada spending much less resources and money per capita, while also covering much more of each person's needs. Even further, if the concern is pure efficiency over the largest number of people, China is one of the most populated countries on Earth, and they spend a measly $671 USD per capita a year. With 95 to 99% of the population included on at least a minimum insurance plan that covers around half of all expenses, this leaves the average person paying around $1,400 to $1,500 USD even without insurance. And this isn't an issue of treatment completeness either, as China's life expectancy is only a year lower than that of the United States, and Canada is actually 3 years higher than our own. The biggest difference is in wait times for elective procedures and non-emergency visits. 67% of Canadians wait longer than a month for a specialist, with only 27% of Americans having to do the same. With insulin spending tripling from $8 billion to $22 billion in the 10 years between 2012 and 2022, and 1 in every $4 spent in the medical field coming from diabetics. With the price of insulin at 8 times the price it is in Canada, and with inflation being responsible for 76% of all profit increases in the medical field, with 19% of Americans having about an average of $2,000 in medical debt, with our government year after year increasing medical spending per capita without regulating its bloated medical economy, how long can we maintain our economic superiority with such a heavy handicap as being placed on ourselves? How long until healthcare actually kills America?